Hello, everyone. I'm so glad to have you here today. I am excited to share something that I believe has the potential to positively influence so many people, including ourselves as physicians, as providers, healers, and be able to magnify our efforts to make a difference in the world. And so I'm really excited about that. This is a presentation about an easy way. Well, I feel like it's a fairly easy way for providers who are practicing medicine, specifically naturopathic providers, acupuncturists, chiropractors, there's others as well, to be able to have their day job and still be able to qualify for PSLF, Public Service Loan Forgiveness. So I'm going to share with you about that. It's really an introduction to the amazing organization called Community Healthcare Resources, and I'll tell you more about all of that as we get going. So, a little bit about me. I am a licensed naturopathic doctor, an NMD in the Idaho Falls, Idaho area in eastern Idaho. I went to NUNM for my Doctor of Naturopathic Medicine, went to New York City for a master's degree before that, did bachelor's in biophysics for my undergrad, also love homeopathy. I'm the owner at Focus Family Integrative Medicine in Ammon, Idaho, do full care, family, naturopathic, primary care medicine, and it's been great. I love it. A few disclaimers. This does not constitute financial advice, so you'll need to talk to a financial advisor about how to best navigate your student loan. This is hopefully educational about one option of how you can approach your student loans, but it's definitely not advice. I am an employee of Community Healthcare Resources, and I'm hoping this will be able to educate others, and you who are listening to this or watching this, to benefit from PSLF. I've really made an attempt to try to make everything as correct as possible. There's probably some details that I'm just might miss. So I'm just going to put that out there. I've really tried to make it as accurate as possible. The diagrams and the information I've gotten from the source, from my own experience in the program, as an employee of this organization. So I'm going to defer you to their onboarding staff who are going to be able to answer it way better than I can. So first of all, what is Public Service Loan Forgiveness? In case you haven't heard of it, it's a federal program run by the government to forgive student loans and discharge them tax-free for those who work in the public service for 10 years or more. It's really helping individuals who are giving back to the community in some ways, firefighters, nurses, doctors, others who are serving the community, but the public. The employer needs to be supporting the public. This includes nonprofit 501c3 organizations. And then in order to qualify, an individual who has their loans must make 120 qualifying monthly payments. So that's 10 years. And then the loans will be discharged after that. The organization Community Healthcare Resources is a nonprofit 501c3 organization based in Iowa. I took this from their website at Community Healthcare Resources nonprofit. Our primary objective is to deliver free healthcare services at no cost to the public. Their goal is to be able to provide a significant amount of value in terms of monetary value of healthcare in pro bono care to the public. To do this, this is quoting from their website, we recruit doctors to independently deliver free and reduced fee care to the public in need. We also offer the benefit to our employees of qualification for PSLF program. So I'm going to refer you to their website, chr501.org, with a lot of great information. And I'll explain how this works and my own experience from it. As I mentioned, who is this really for? This is for providers, healthcare providers, including naturopathic physicians, which I am one of them, acupuncturists, and chiropractors as well. What does serving the public mean? In this case, serving the public means delivering healthcare to the public. So delivering $500 worth of healthcare to the public every month. If we think about it, a patient visit is maybe $200 to $300, depending on which code you use. You do a couple of those a month. You write off some of the what if somebody can't pay their full bill, you can write it off. That can count toward this value. In that process, you're providing healthcare education to the public, both individually. There's also community presentations and so forth. And in doing that, providing that care in your own clinic setting with your own supplies, you're really donating the use of those supplies, your office, to the public. And all of these things packaged together, they figured out that this, with the IRS, constitutes public service and therefore qualifies for PSLF. As you can see, it doesn't need to be a lot to make a difference. And I think it's really cool as a provider with my own clinic to be able to offer this care and to the public while I'm still practicing in my normal practice. So I really like that. So as an employee, we'll get into more into money flow in a minute, but as an employee, you earn a salary, and really that salary is 30 hours a week times minimum wage. This salary, because you're working for a nonprofit, is what is reported for the purposes of PSLF, student loan repayment, and that the IRS, your student loans, they don't care about other income made from other sources. So really, this salary is what counts. The main responsibilities of somebody who is an employee of this program, there's 4 R's, and I'm taking this from their material. Number 1, recruit yourself, which is yourself, so you can sign up and recruit yourself to provide $500 worth of care. Technically, in theory, you could recruit somebody else to provide that care as well. But nevertheless, you need to recruit someone to provide care. You need to record that care that is provided. There's a form that you fill out, record the date of care, the CPT code, report that care provided to them, what's an annual basis, and then raise a donation to cover the cost of a salary and also the organizational operating costs of the nonprofit organization as a whole. So 4 R's: recruit, record, report, and raise money for the nonprofit. Because it's a nonprofit, they work on donations. And with those donations, then they pay their employees to be able to provide that care. Does it sound too good to be true? Where you can work at your own clinic, you give a few hours of pro bono care a week or a month, you help raise funds, and that qualifies for PSLF. It almost sounds too good to be true, but it's not. So each month you do make a donation to CHR, Community Healthcare Resources. This includes and covers the cost of minimum wage. So minimum wage times 30 hours a week, at least where I am located in Idaho, that's roughly $800. But we have a fairly low minimum wage rate. So if you're in another state where minimum wage is higher, you can calculate what that would be. Employment taxes, it covers all those. And then the operational expenses of Community Healthcare Resources, which roughly 500-ish a month, and all these numbers are depending on which state you're practicing in. These donations can come from, so donations is what you give to CHR, and then what comes back is your paycheck. They're tax deductible, so I'll get into that in a minute. Tax deductible, which means it's really a benefit to you tax-wise as well, to your practice, however you want to do it. Okay, so this is a flow. I'm going to show you how the money works, because for me, this is the biggest question that I had going into it. the question that I had when I was trying to piece together, okay, what is this organization? How does it work? And how can I benefit from it? So ultimately, when we're providing care, we deliver that care to the patient. The patient pays a practice, usually. We're operating under a business. Those patient fees go to a business bank account, whether it's a check, whether it's through insurance, whether it's through a merchant services, direct credit card payment, whatever. Those fees go to the business bank account. Now, typically, that business bank account is used to pay the doctor, in this case me, as a salary. So that salary comes from the business bank account, whether you use an HR system, however that works, that is transferred from business to personal. For me, I have my own practice. It's a very small operation, so I'm kind of like, it kind of blends together. In some ways, it touches very closely. It'll be different for everyone with their practice. It is that salary that is then used to reported to the IRS for the purposes of student loan repayment. And this is specifically referring to the SAVE program, the income-based repayment program. But there are other repayment programs out there as well. So that's usually the flow of what happens in a normal business operations. With this, it works a little bit differently, and it's kind of cool. So we deliver $500 worth of care, $500 per month of care to the public. And my image is cutting it off. It just basically says whatever patients can't pay on the far right. Whatever they can't pay, that is the value of care that is being given to the public. Now, instead, so that's the value. There are donations, as I mentioned, that go to your own. Within CHR, you have your own bank account, and that's where all the donations go. That can come from your personal bank account. It can come from a very nice, financially well-off benefactor. It can come from your business bank account and be a tax write-off for your business. But those donations cover your salary, taxes, operational expenses. They can also come from grants and other sources of fundraising. So as an employee of CHR, you are working for a nonprofit, you can go out and apply for grants from other people, which is from other organizations, which is pretty cool. Those all go into your personal CHR bank account. Those funds are then go to the CHR organization as a whole. From that is used to then on the left as given back to you to your personal bank account as a paycheck. This is a W-2 paycheck, just as you would get a W-2 from any other company. And it's this paycheck, not your personal paid salary from the practice, that is reported to the IRS for the purposes of PSLF. So instead of this bottom pathway, you can't see my mouse cursor, but nevertheless, the bottom pathway is not how money flows. You flow up from patient fees to your business bank account, up to your personal CHR bank account, to the CHR organization, back down to you, your personal bank account to cover your personal living expenses. And that is how money flows. It's a fairly straightforward process. It's a smooth process. It takes a minute to wrap your head around. At least it did for me. That's why I made this. I ran it by Dr. Jay Johansson, who is one of the main people that I interfaced with at CHR. He said it's spot on, so that's why I'm including it here. So CHR employees do need to sign up for the income-based repayment program, the SAVE one. The nice thing is, because you're paid minimum wage, the amount that you pay in student loan repayments monthly is zero, just because it's the low the salary is that you're getting paid from CHR is what is reported. Therefore, because it's low, you don't need to pay any income, any money for your student loan monthly payments. I'm going to back up because I forgot a detail. You also there's this flow of money that I talked about. The paycheck is not going to be sufficient for your personal needs. So you can have other money coming in from your business bank account to you directly. That is still permissible. But in order to be part of this organization, there does at least need to be that up and down flow from your business to CHR back down to you. So there is that flow, but you can also make other money other places as well. There's not a limit to that. What does the process look like? If you're interested, which I was, this is the process that I went through. I talked with Dr. J. Johansson. He's a chiropractor who works at CHR. We got all my questions were answered. We confirmed that my loans do qualify for public service loan forgiveness. There's all of the employment applications and onboarding paperwork. There is an initial donation, just to be aware, to cover all of the onboarding expenses, because there are a few. You need to consolidate your student loans and then complete the public service loan forgiveness application. And in that process, your student aid servicer will switch from what it is right now to a company called Mohila. And Mohila is the one that oversees PSLF, student loan servicing. Every month, you contribute your monthly donation by the 15th of each month. You get paid on the 21st. And then you go and offer your care, free discounted care. Every year, you submit a report once a year in January with the date, the CPT code, and the value of that care that was provided. And there's more details there, but for the simplicity, the value that it's there. Does it work? It's the kind of the too good to be true question. Does it work? Yes. Once you're all set up with PSLF, once you submit your PSLF application, CHR fills out their portion of it. It goes back to the Department of Education. The loans are transferred or managed, then servicer to Mohila. And then you'll be able to start seeing that your work at CHR, I put CHF here, not congestive heart failure, CHR, is being counted toward PSLF. So you'll be able to get that evidence right pretty quickly that you're on the right track to get public service loan forgiveness, which is pretty cool. Why I like being part of CHR. So this is my personal experience. I really like the opportunity that it allows me to give back to the community. And it's meaningful. In Idaho, naturopathic medical doctors, which is how we're licensed in Idaho, are not able to, are not covered by Medicaid. Or Medicare, but that's federal. But at least for Medicaid, we're not covered. So I've interacted with several patients who want to come see a naturopathic medical doctor like myself, but who, because they're on Medicaid, can't afford it. Their income is not stellar. They're not able to pay out of cash for this visit. It gives me that freedom then as a provider in my clinic to be able to then say, that's okay. I can still help you, and I'm still willing to help you, and I want to help you, because that's why I went into medicine, to help people. But in this case, I can say that I also work for a nonprofit organization who helps individuals receive high quality healthcare, who may otherwise have difficulty paying for it. And it's just, I love the freedom of being able to say that and be able to continue to help people, even if they don't have a huge cash flow on hand. I do like that there's no student loan payments each month, or the value of my student loan payment is zero, and ultimately that the loans are forgiven, and gives me that kind of security, freedom in a way. So I really like that part of it as well. If you're interested, you can go to the website, chr501.org, to learn more. I will also put a link in the video description here down below, so that you can go on there and start the process. And what is nice, I believe it's my next slide, if you are still a student, if you're still listening to this, and you're still a student, like, why should I care about this right now? You should care about this right now, because you can still sign up to be part of CHR, Community Healthcare Resources, as a student. So instead of like working, like you're still in school, you're not like actively seeing patients per se. There's other activities that you can do, community education, service, or other things that count as toward public service. And that student loan forgiveness can start while you're still in school. You heard me right. It can still start while you're still in school. And then CHR can work with you on the financial part of it as well. I think that is amazing, because even a year or two makes a difference. If you're trying to repay your loans and wanting to get them forgiven, you can start that clock ticking earlier than right after when you graduate. So I think it's pretty cool. I think there's some opportunities there. So that's why I'm sharing this, particularly with students, so that they can know about this opportunity. And if it's not, the timing isn't right, that's totally fine. You can still think about it later, but if you are interested, you can start soon and get going, so that by the time you're done school, you can be able to get out and then move quickly. You're already on track for public service loan forgiveness, which is pretty cool. I think it's amazing. It's an amazing organization that I'm grateful to be part of. If you have any questions, feel free to comment on this video. Visit chr501.org, or I included their email, and I'll put that in the description as well, support@chr501.org. I hope this has been enlightening to you on your journey, whether you're still in school, recently got out, or whether you've been practicing for a while. I hope it can be a resource for you, so that you can be able to more effectively give back to the community, to the public, but also benefit from the public service loan forgiveness qualification as well. And that, I think, in many ways allows us to then go off and serve and make a bigger difference down the road than we otherwise would be able to. So thank you for listening to this far. Reach out if you have any questions, and I hope you have a most wonderful day, because you deserve it. Thanks.